Thank you very much, Jenna. You know, slippery roads and fender benders can mean busy time for the chiropractor. So with a little lesson in whiplash and how you can find relief, we brought in chiropractor Dr. Shapiro. What exactly is whiplash? Because all of us have heard that term. Well, what exactly is happening?
Well, yeah, it's a very good question. I mean, there's an article recently that MPI was saying how on average there's about 29,000 car accidents per year in Manitoba. I wouldn't doubt that this year they were well above average, and over $4 billion a year are spent on injuries directly related to car accidents. So today we're here to talk about the most common, which is whiplash, which is something close to my heart because it's something literally I look after every day. One of the specialties of ChiroCare is looking after people who've been in car accidents and their injuries. And when I was a kid, I was in a car accident, and that's how I found out about chiropractic. And it made such a big difference. Both my brother and I are chiropractors because of a car accident.
Wow, there you go. So what exactly happened? So I'm in my car, I'm listening to the tunes, and then bang, right from behind.
Okay, well the first thing is that, yeah, that's typically the most common. We're going to talk about just a rear-ended car accident. Now what happens is if the camera wants to focus in, is you typically have a nice graceful curve in our neck, a C-shaped curve.
Okay.
Now when the physics of an accident...
This is good, this is the good
This is good, this is textbook normal in fact. When someone's rear-ended, the car actually accelerates underneath us, and due to inertia, our head actually stays put. So what I'm going to do is I'm going to use this nice tinfoil curve here.
Spared no expense on that
Exactly, I went all out. So what happens is that the car accelerates underneath us, the car seat propels our head forward, or propels our back forward, our head stays put. So in the first few seconds, what happens is it goes from a C shape to an S-shaped curve as our body goes forward. Eventually, our head catches up and whips forward. Now here's the interesting thing that many people may not understand at home. The injuries, this S-shaped compression on our curve that's abnormal, happens in the first 150 milliseconds. Literally, it's like that. So often people don't even realize that there's been an injury that's taken place. And to a certain degree, sometimes as people, we get in a little bit of denial. Oh, I'll be fine, I'll be fine. But what happens is that often patients will come in talking about they heard a bang, they realized they were in an accident, went to go exchange information and couldn't see because their glasses were on the back shelf of their car or in their back seat from their head snapping back. That's something that people often tell me.
Wow.
Yeah, and so often things happen where you get injured and the head snaps back. You can't stop it. You can't prevent it. It happens within the first few milliseconds of the accident.
Okay, so I've been in an accident. I have that soft tissue damage once I exchange numbers.
Yes.
What should I be doing as far as treatment goes?
Well, the first thing you should do is ice. A lot of people wonder, oh, I wasn't sure if I should ice, I should heat. There you go. In fact, when someone's in a car accident and you call in and that you get your claim number for your car, you can actually call in and get a claim number for yourself for injury. In fact, I had a patient yesterday afternoon who came in, rode off his car a few weeks ago, has not been in, and he's been in excruciating pain. Finally, he couldn't take it. He came in, and he didn't realize that his injuries would be covered. So the first thing is AutoPack covers, we give him an ice pack. We also give him an orthopedic pillow, which as we talked about earlier, the proper curve in the neck is a C shape.
Man, so this has actually got a little bend in it so that you can get that curve
exactly.
that it's supposed to have.
Yeah, and this is not something that's frivolous. Everybody should be on something like this, but it shows to make a big difference when it comes to whiplash. And MPIC will actually pay for someone to get that in order to facilitate the healing of their neck if they do in fact have whiplash, which is something that we figure out when people come in.
So there are some things that are covered. There is some help for you. There is some relief for you.
Absolutely.
There's also ways to prevent that. So if you can stick around, we're going to talk a little bit
Absolutely.
about prevention, exactly what you can do when it comes to your car seat to make sure you're feeling all right. We're going to take a break. All that info, by the way, you'll find it through breakfasttelevision.ca. Going to take a break. Still plenty to come today on BT.